Once you've decided to help in an emergency, your first and most important concern is your own safety. Emergency scenes can be dangerous. If it is not safe for you to help, don't. If the situation is beyond your ability to help, activating EMS may be the only thing you can do. The acronym SETUP can be a useful tool to help you remember the key elements of scene safety. S represents stop. When you see someone who may need help, pause for a moment before you approach. Look for any obvious hazards. Form an initial impression of what happened. E represents environment. Pay attention to your surroundings. Take into account any environmental barriers or dangers that could endanger you or others as you begin to provide care. T represents traffic. Be extremely careful if you are providing first aid on or near a roadway. Each year, many people are struck and killed by moving vehicles while providing assistance. U represents unknown hazard. This includes dangers that are not apparent. Keep alert for developing hazards. It may be necessary to retreat from the scene. P represents protect yourself and the patient. Infectious diseases can be transmitted through open cuts or sores in the skin or through the mucous membranes of the mouth, nose, and eyes. The use of protective barriers may be mandated by regulation and will help reduce the risk of exposure to you and the patient. To protect yourself, use disposable gloves when providing first aid care. Be sure gloves are not damaged when you put them on and replace them as necessary. Remove gloves carefully to prevent splattering. Grab the outside wrist of one glove with the other hand. Turn the glove inside out as you remove it. Drop the inverted glove into the other hand and slide your finger under the other glove to invert it and trap the first glove inside. If you need to provide rescue ventilations, use a ventilation shield or ventilation mask to eliminate direct mouth-to-mouth contact with the patient. If you have a history of allergic reactions to latex, use a non-latex alternative such as vinyl or nitrile. When you decide to assist in a medical emergency, start your care by forming an initial impression of what happened. Avoid gathering detailed information. Just form a basic sense of what occurred so you know how to proceed. There are two important conditions to immediately consider: if a patient appears to be unresponsive, and if a patient appears to have been seriously injured by a great deal of force. Both of these conditions require early intervention on your part. The most critical early impression is whether or not a patient appears responsive. Introduce yourself and inform the patient that you are a trained first aid provider. Do this even if he appears to be unresponsive. If he does not respond to your voice, tap his shoulder and shout, "Are you okay?" As you will learn, unresponsiveness indicates a serious life-threatening condition that requires immediate care and activation of emergency medical services, or EMS. Another early impression to form in a suspected medical emergency is if you think a serious injury may have occurred. The process by which external force results in injury is known as the mechanism of injury. An important consideration is whether injury to a patient's spinal cord may have occurred. Any significant force affecting the head, neck, or back has the potential to injure the spine. Injury to the spinal cord can result in serious problems, such as paralysis or loss of breathing. The spinal cord is protected by the bony vertebrae that make up the spinal column. If a vertebra is damaged by injury, it can leave the cord unprotected. Movement of damaged vertebrae can result in permanent damage to the spinal cord. This could lead to serious, even life-threatening conditions. It is best to consider the potential for spinal cord injury early and minimize patient movement throughout your care. When you suspect an injury to the spine may have occurred, get into a comfortable position and use both hands to hold the head in the position you found it. Do not lift the head. Simply cradle the head to keep it from moving. Keep the head stabilized until EMS personnel take over. Movement of a suspected spinal injury should only occur in order to establish an open air passage to the lungs, or to protect a patient who is in serious danger from his surroundings.
Outside of a hospital, the Emergency Medical Services System, or EMS, plays a critical role in caring for medical emergencies. A typical EMS system uses an integrated approach. Usually activated by a phone call, a specialized emergency communications operator will gather information and dispatch highly trained EMS responders in emergency vehicles to the scene. If you suspect a medical emergency exists, activate EMS as soon as possible, even if the situation is unclear and you are in doubt as to what may have occurred. If available, have another person call so you can provide care. Contacting EMS is generally as simple as dialing a telephone number, such as 911 in the United States and Canada. If you are alone with an unresponsive patient, make the call yourself before providing additional care. When you call, an emergency operator will ask for basic information about the emergency. At the same time, a separate person or emergency dispatcher will likely be alerting the appropriate resources to respond. Remain in contact with the emergency operator until EMS arrives or you are instructed to hang up. In many EMS systems, emergency operators are trained to provide verbal assistance to help you administer care. Some workplaces have site-specific emergency plans in place, including the use of in-house emergency response teams. Become familiar with your company's emergency response plan. Consider developing an emergency response plan at home, as this is where the majority of medical emergencies occur. Found in the air we breathe, oxygen plays a fundamental role in sustaining our lives. Providing oxygen to body tissues is a continual process involving the lungs, heart, and blood vessels. Body tissue requires a constant supply of oxygen. When oxygen flow is disrupted, body tissues will begin to die. Brain tissue is the most sensitive to a lack of oxygen. Irreversible brain damage can begin within 4 minutes. After 10 minutes without oxygen, the chance for survival is generally gone. In most cases, EMS providers can't respond in time. The only hope is care provided by a bystander. Getting oxygen to the brain is dependent on what are described as the ABCs, an open and clear airway or air passage to the lungs, adequate breathing, and effective circulation of oxygenated blood to body tissue. The circles of care illustrates the concept of providing basic life-supporting care for the ABCs. The outer circle describes the process of an initial assessment. The inner circles, labeled A, B, and C, show the dependent relationship between airway, breathing, and circulation, and how none can exist without the others. The small circle in the middle, labeled OA, represents the importance of the ongoing assessment. There are 5 simple life-supporting skills you will learn to perform to manage problems with the ABCs. Positioning a person's head to create an open airway. Rolling a person to clear fluids from the airway. Placing a person comfortably on his side to protect his airway. Blowing into a person's mouth to provide the lungs with air. Pushing on a person's chest to move blood through the body. These are the most important skills you can perform as a first aid provider. First, you'll focus on mastering each skill individually. Later, you'll learn how to apply them in an emergency. The airway is the passageway between a person's mouth and lungs. It is the only means for getting air, containing oxygen, into the lungs. Loss of an open airway can quickly lead to serious problems and death. The most common cause of a blocked airway in the unresponsive patient is the patient's own tongue. Patients who are unresponsive often lose muscle tone, which allows the base of the tongue to relax and block the airway. The tongue is attached to the lower jaw. Moving the jaw forward lifts the tongue away from the back of the throat and opens the airway. You can open an unresponsive patient's airway using the head tilt chin lift technique. To perform head tilt chin lift, place your hand on the patient's forehead. Place the fingertips of your other hand under the bony part of her chin. Apply firm backward pressure on the patient's forehead while lifting her chin upward. This should tilt the head back and move her jaw forward. Use your hand on the patient's forehead to maintain the head tilt. Keep supporting the bony part of the chin with your fingers. Avoid pressing too deeply into the soft tissue of the patient's chin with your fingers, as this can also block the airway. Leave the mouth slightly open. Once an open airway is established, you must continually maintain it. If you let go, the airway may close again. Keep in mind it is essential to first establish an open airway in order to assess for breathing.
Hey, Ronnie! Ronnie, you okay? Hey, you all right, buddy?
When caring for a patient who is seriously injured, establishing an airway is a higher priority than protecting a possible injury to the spine. Without an open airway, all patients, regardless of illness or injury, will quickly die.